because I think they do have particular relevance to healthcare ethics. One thing we want to say about ethical theory in general is that all ethical theories relate in some way to human nature. We're going to see that some of the ethical theories that are reviewed in the chapter deal with human choice, reasoning, capacities for pleasure and pain, the buildup of character and virtue, as well as this question about our ultimate goals and aims within human nature. So we're going to see that these are related to a lot of the bioethical principles that we'll deal with. And some particular principles, such as informed consent, are going to lean towards one particular theory more than another. So we'll see a lot of Kantian deontological references, for example, in informed consent, dealing with autonomy and rationality and choice. So the four we're going to look at: consequentialism, which is also referred to as teleological, telos in Greek meaning goal or end; deontological, deon in Greek meaning duty, and we're going to see one of the principal philosophers in ethical systems in the deontological approach is Immanuel Kant; natural law, which is going to be kind of a combination of means and ends. Natural law says that human beings and nature in general are oriented towards particular goals, and that anything that kind of thwarts or artificially stops those goals has moral problems. And virtue-based ethics, which traces itself back all the way to Aristotle, but looking not so much at individual actions and decisions, but looking at the habituation, the buildup of character. And we're going to see, I think this has particular relevance in medical training. So let's start with our first, teleological or consequentialism. In this ethical theory, we're going to look for the rightness or wrongness of a particular action in terms of the consequences or the ends brought about by that action. One of the primary ethical theories that lends itself to this approach is utilitarianism. The two principal philosophers in utilitarian theory are Jeremy Bentham and John Stuart Mill. Both are Enlightenment figures, and both were looking to really reform a lot of the criminal justice system within their time in the court system. They said that we should look at a particular act in terms of the impact it makes. Sort of the idea that punishments should fit the crime. They were trying to do away with unnecessary punishments and tortures and dungeons and things like that. And they were also looking for really an objective and equitable law system, one that didn't reward higher class versus lower class, but looking at any action or decision in terms of its consequences and utility. And the phrase that we're going to look at is that an ethical decision is good if it leads to the greatest good for the greatest number. This was also seen as a moral calculus. Both Bentham and Mill believed that you could measure the outcome in terms of hedons. Hedons were a measure of pleasure and goods. And even though Bentham and Mill had disagreements really about how hedons should be measured, both were sometimes critiqued as being kind of a hedonistic approach, that it was all based on pleasure. But if you look at the writings in full, they really start to move into almost a notion of health, that while certain pleasures can be momentary, we need to look at the long-range goods and the long-range sense of pleasure. So in the short term, for example, smoking a cigarette might induce pleasure, but over the long run, that's going to lead to more and more health problems, difficulty breathing, difficulty doing different actions, so that would not be seen as high. Here is an example of Jeremy Bentham. Really kind of put his body where his philosophy was. At the time, it was very frowned upon to do anything with the body after death other than a proper burial. And Bentham wanted to donate his body to science. At the turn of the century, and medical schools were starting to learn about human anatomy and physiology, and he really donated his body for science. The remains that we do have, which is a wax head and hands and feet and stuff, are still in preserve at the University of College of London. And as it is noted in the book, The Moral of the Story, he's brought out for board meetings as being marked as present but not voting. So your book takes the example of artificial contraception or birth control to kind of run through each of the theories and just to try to take a look at what's kind of being considered as we look at the morality of contraception. I just want to note here that no ethical theory is going to pump out simply one answer. It's going to raise certain considerations, and then it's the job of ethical inquiry to kind of follow through with those arguments. So let's take a look at the utilitarian approach. So we certainly see the benefit and the good of pleasure. All right, so the bodily pleasure of sexual activity is valued. But what is the possible good? What's the hedons for the greatest good for the greatest number in terms of having a child or not having a child? It would depend. Notice here that in utilitarian theory, even wider society has a role to play. So as much as Americans kind of cringe at China's one-child policy, there are concerns about wider population and impact that would be calculated in a utilitarian approach. So all of those factors are kind of put into play in terms of the question of the moral use of contraception. Let's move into the deontological approach. Here, we're going to look at the means or the action itself, not so much the ends. Oftentimes, the means or the action is really judged in terms of obedience to codes, laws, imperatives. There could be possible goods or outcomes, but if that means or action is not in alignment with an oath or with a particular just law, then it is not acceptable, even if it leads to good ends. We can trace back some of this emphasis all the way to the Hippocratic Oath, which is one of the first ethical statements, and again applies to medicine as well. In the original Hippocratic Oath, we see prohibitions against surgery, abortion, sexual relations with patients, somewhat interesting connections in terms of modern science and medicine today. It should be noted that we often connect this with the phrase do no harm, and that phrase actually does not appear in the original Greek. There's a website here for a Nova series that really looked at the history and the many formulations of the Hippocratic Oath. It still depends on medical schools and programs, whether you take an oath or not, but all of this certainly needs to be understood in context. The principal philosopher we're going to look at in deontological theory is Kant, Immanuel Kant. And what Kant said is that an idea or an act must be described as good if it expresses certain characteristics, such as universality and conformity to moral law. Dion in Greek, again, means duty. But Kant would note that sometimes we can have duties to unjust laws, or we could follow authority figures that are immoral. So what he said is that we need to focus on goodwill. And oftentimes we use the phrase goodwill or good intentions as kind of an emotional appeal, caring about doing the right thing. But in Kant, goodwill means a rational analysis, making sure that we're following the universal moral law, or what Kant would call categorical imperatives. Here are two formulations of the categorical imperative. One is often referred to as the humanity formula. Kant said, whatever you're doing, make sure that you treat humanity as an end in and of itself. In other words, that human beings must never be used as a means towards some other goal, but always as an intrinsic value unto itself. We're going to see that this has a lot of role to play in the way we think about informed consent in healthcare. Another version of the categorical imperative is the universalization. Take whatever act or means you're doing and ask yourself, what if everyone were to do as I'm doing? You take, as Kant would say, your maxim and make it into a universal law. If you can conceive of a good world in which people followed that, then you should follow it. But if others were to do as you were to do and it would lead to problems, then it should be cast aside. So let's go back to our example of contraception. A deontological approach wants to look at the means of contraception. And there might be two conditions that would make this probably morally problematic. Is the partner using the other as a means of sexual pleasure and not respecting their autonomy and reason? There's the humanity formula, making sure we're never treating another person as a means to our end. Also, any condition in which the partner was lying about the use of contraception would equally be problematic. Kant would not be as interested in the context of emotion or the role of the relationship, but he would be interested in the means of contraception. Would this infringe upon the personhood of the potential child? We're going to see this consideration comes up much more in natural law theory as well. But again, trying to universalize your action or decision and making sure that you're never treating another person as a means towards an end. Virtue-based ethics. We're going to see that virtue-based ethics really kind of predates a lot of the Enlightenment theories we've looked at so far. Aristotle is largely the principal author of virtue-based ethics, and it was a practical approach in which you're looking at patterns of actions or decisions. We can say that doing one thing one time does not necessarily make you a good or virtuous person. But Aristotle would say we want to make sure that we are training, particularly the young, to find virtue in their life through habituation, through doing it repeatedly. He also said that virtue should be seen as a golden mean, a balance between extreme forms of behavior. So I give two examples here. Courage. Courage is this balance between cowardice, not acting and withdrawing, and rashness, jumping into a situation without thinking it through. I give the other example here of pride. But what Aristotle was interested in is institutions and largely the polis, the city-state, was a way to educate and to help young people find that balance, that golden mean of the right balance of action and decision, and to make sure we do that repeatedly so that it becomes part of our character. How might a virtue-based approach relate to medical training and healthcare ethics? I think we're going to see as we look at different types of training and certainly the role of compassion and care, we want to try to make sure that we emphasize to repeatedly go back to this concern for the patient and concerns about health. Yes, there are sometimes immediate situations and decisions, but virtue-based ethics is looking at the long-based approach. We'll go back to our example of contraception. Virtue ethicists believe that contraception is neither good nor bad, but must be evaluated over with a particular set of circumstances and over a period of time. What is the social history of these practices? What are the practical consequences for both individuals and societies? So some example, does the repeated use of contraception lead to an extreme form of behavior, either promiscuity or frigidity? Maybe the habitual use of contraception would be seen as a virtue by creating a balanced means of family planning and control. So again, it's not the individual decision about whether to use contraception or not, but how does this fit into a larger framework of behavior? The last ethical theory that we're going to look at is natural law. Natural law can be based on a rational reflection on nature, and human nature included, and looking at how it will yield principles of good or bad that guide action towards human fulfillment or flourishing. So there are both secular and religious versions of this. One example is John Locke, who had a notion of natural law and natural law ethics. But we're going to look at a particular religious version in the Roman Catholic Church. The question can be asked, is the intended natural purpose, there's that word again, telos, the end or goal, of a particular action or decision, thwarted or stopped by an action or decision? If so, then that's not morally permissible. So let's look at the example of Thomas Aquinas as one religious version of a natural law theorist. Thomas Aquinas came up with a theory of natural law, which said that